My name is Donna Anderson. I've worked for Waterbury Hospital for 35 years, mostly as a registered nurse. I started off there as an LPN many, many years ago and have chose to stay there because it was always a good place to work. I'm deeply concerned over this about the takeover on multiple levels. First and foremost, I am concerned about the takeover by LHP. How is it going to affect the ability for the nurses to take care of their patients? Let me be more specific. I apologize for reading because I get a little nervous. Nurse retention is one of the contributing factors to making Waterbury Hospital an area leader in care. Our retention and experience levels have been wonderful at Waterbury Hospital. We have a large number of senior nurses, but nurses and many other staff are leaving or looking for other jobs because right now they feel their jobs are in jeopardy. And the work environment is very unstable. Every year we replace nurses to maintain a level of care we need. We know that about 1/2 of our nursing staff will retire in the next 5 years. Yet it's not possible to reduce hundreds of beds and staffing simply by attrition. We've got tremendous workload in the emergency rooms. They're full. Frequent border situations, the workloads on the floors have increased tremendously over the past year. Who will take care of these patients? And what will be the expertise of the RNs that are taking care of you? We also have huge concerns about what it means to go for profit. We have very little experience in Connecticut with for-profit care. At Sharon Hospital, which went for profit, word is that they stabilize uninsured patients and then send them to other facilities that have a nonprofit mission to take care of all. We don't know that LHP can stabilize both hospitals and satisfy the pension debt at St. Mary's and still make a profit without harming care. We need a lot more information that they're not willing to give us. Waterbury Hospital has cut back employee benefits and health insurance for hundreds of workers and outsourced jobs. RNs are impacted by the cuts to our co-workers. These co-workers are the people that help us take care of you. RNs are subject to higher patient loads. In my department, I work in the telemetry unit. We're operating now 25% higher than the national standard. That causes harm to our patients. This has all happened recently, within the past year. It's gotten worse, much, much worse. This is the hospital that LPH thinks it can make a profit off of. We have not made a profit in 10 years. How do they think that they're going to be able to come in? We have expertise in our management in both hospitals. They've been there for years. They have not been able to turn a profit. What makes them think that they can come in tomorrow and make a profit? Scares me to death. We have real questions we need answers to. How stable is LHP? They've only been around for a few years. Can they really make good on their promises and turn a profit? How many jobs and beds are they planning to eliminate? What will happen to uninsured and underinsured patients who come to the hospital? Every day we see patients in need. There's no appropriate place for for-profit care in the views of the nurses at the hospital. Who is the LHP group? These are outsiders. They do things differently in Texas. Will LHP respect the diverse needs of our population? LHP has a board of directors with no diversity and, amazingly, no women on their board. What guarantees that LHP provide that they won't try to balance their budget on the back of the hospital's best resource, its staff, or on taxpayers? What kind of corporate welfare will LHP be looking for from the state? Will they respect our right to voice at work and our contracts? Will they allow us the security to speak out for our patients and support of our families? These aren't just worker concerns. These are issues that affect all patients. We are asking that LHP meet with the workers and the community and put their commitments in writing. We need that. Thank you for listening to our concerns.